My name's Adam Sachs, and I'm currently the Deputy Director of Clinical Support and Corporate Services over at Monash Health. I've taken a lot of steps to get to my current position, and one of the big impacts that actually got me to where I am was my time with the Australasian College of Health Service Management as an intern back in 2011. I previously was working in nutrition and exercise science, and ended up finding that I was doing a lot more management work, a lot of work with people and teams, and a lot less of that clinical work. So saw an advertisement for the intern program and decided this was a great opportunity. To be honest, I had no real clue what I wanted to do in management or how I wanted to work in hospitals. And that was probably the biggest change and biggest advantage of the intern program was to experience four different placements at four very, very different health services within different teams. From my experiences that I worked at, I was able to really build a network of people, really grow those relationships with key stakeholders and leaders in the industry, which really helped me along the way. I could also see what I really loved doing, where my strengths were, where my weaknesses were, and what I needed to do to grow and develop as a manager. Now, I started off in working in strategy, where we got some experiences that I would never have achieved just as a general worker. To have face-to-face meetings with the CEO, with the executive team, to be dragged into those meetings was just a really valuable experience and something that I still think back of those lessons learned within those programs, that I still take today for the work that I currently do. My second placement was actually at Monash Health there, and once again, moving and being there at Monash Health, I still work very, very closely with a lot of people that I did back in 2011 as an intern, that are still around to this day there. So once again, those relationships that I was able to build not only helped me get my foot in the door and in those roles, but also has been able to continue those relationships as we go. Once again, I moved from strategy to capital over at Monash. It was an experience in that project management side of things that, once again, to be face to face in very high level department health meetings was just an experience that you wouldn't get if it wasn't for the intern program. After that, I went over to Peter Mac in my third placement. And by the third placement, I had a little bit more of an idea of what I like doing and got thrown into the Viner implementation program. It was an absolutely fantastic experience, once again, utilizing my skills that I'd had in my first two placements, but also just getting more of that implementation side of things into it. And finally, finished up over at St. Vincent's Hospital over in redesign, which was a great tool to just have a view of efficiencies of how to deal with work. And once again, within my current role, I still look at a lot of the lessons that we learned from that way of thinking from those projects to review the efficiencies of what we're currently doing today. The group of interns that I shared my experience with through the intern program are still people that I communicate with very, very regularly still today. And we really do see ourselves as, those future leaders there. It has been, a valuable experience where my first job when I finished the internship program was with someone who was very closely linked to the college to get my foot in the door. So those relationships that I was able to build really did assist with taking those next steps there in my career. Once again, I really do think that, and one of my things that I've been able to do is try and give back to the program as a result of this. So I am very heavily involved in the State Branch Council, and it is one of the big joys we get of having interns now at Monash Health sitting under our team that we can see and develop those future leaders that are coming through the program and into the workforce. Once again, I really think it was a great experience. It is a lot of work to be involved in the program, managing a master's degree with uni with a full-time workload, but those are experiences that you just wouldn't get in any other environment. So I really highly recommend it.